Welcome to the Boulder Health Champions webinar series. I'm Dr. James Barnes, a GP trainee currently working in public health in Birmingham. In this month, we'll be looking at diabetes and its impact on the Birmingham population. This webinar series will look to broadly outline what diabetes is, as well as looking at how big the problem is for our communities. We'll also focus on where public health and the Boulder Health Champions can help to make things better. So before we start, I think it's important that we take a little bit of time to have a look at exactly what diabetes is, what causes it, what some of the symptoms are, and also some of the treatments that might be available. So to start with, let's talk about what diabetes is. Diabetes is a lifelong health condition caused by an underactive pancreas gland, leading to uncontrolled high blood sugar. We'll look in more detail in a second about the two main types. Diabetes in its early stages may be treatable with lifestyle changes alone, but further on the line might need medications such as tablets or even insulin injections in the more advanced stages. Untreated, it can be very serious, causing problems with kidneys and eyesight, and can even lead to limb loss, heart attacks and stroke. Although there are many types of diabetes, including ones that only occur during pregnancy, today we'll look at the two main types of diabetes. Type 1 is autoimmune, which means that the body's own immune system mistakenly attacks the pancreas, which causes it to stop producing insulin, which is the key that allows vital sugar to move into the cells of the body. It's not currently considered preventable, but is manageable with insulin injections. Boulder Healthier Champions can help here by spreading awareness and making sure that people with type 1 diabetes are supported in their self-management. Type 2 diabetes, on the other hand, is more related to insulin resistance, where the supply of insulin can't keep up with the needs of the body. It's linked with obesity and is considered to be preventable with a number of lifestyle changes. We'll look later at pre-diabetes and the role of screening in this. In terms of the role of Boulder Healthy Champions with type 2 diabetes, the role focuses much more on promoting healthier lifestyles and raising awareness, and most of this talk will focus on these elements. In terms of the symptoms that we might see in someone who has diabetes, the uncontrolled high levels of sugar in the blood can cause a number of different problems. Firstly, the high blood sugar levels can cause increased thirst, which in turn causes someone with diabetes to need to go to the toilet more. Because of the lack of insulin, sugar can't get to where it needs to be in the body, which this leads to people having low energy, being slow to heal, whether when they cut or bruise, or sometimes losing weight unexpectedly. However, it should be noted that everyone is different, and some people might have very few symptoms despite being quite unwell. In some cases, people only find out that they have type 1 or type 2 diabetes when they end up very poorly in hospital. So how big is the problem for our communities? The infographic you see on screen was put together by the former Public Health England and gives some more detail about the scale of the problem. At the current trends, 1 in 3 people in England will be obese by 2034. And 1 in 10 will have diabetes, with rates being higher in the South Asian and African Caribbean communities. This currently costs the NHS £8.8 billion every year, and this will only increase over time. In Birmingham, diabetes is a particular problem, with rates seen being around about 50% higher than the national average. Undiagnosed and untreated, diabetes can cause a number of health problems. On screen, you can see just a few of those that can be seen in people living with diabetes. All of these are more common and more severe with poorly controlled blood sugars, helping people to access healthcare and live healthy lives and prevent many of these complications from occurring, even in people with diabetes. Before exploring what we can do to help, it's worth looking at the things that put people at an increased risk of type 2 diabetes. The most important risk factor by far is obesity. Those with a BMI of 25 or more and a waist circumference of more than 31.5 inches in women and 37 inches in men are at a 7-fold increased risk compared to those with a healthy weight. This comes alongside risk of other problems linked to obesity, such as heart disease and stroke. Family history and age also plays a part as well, with older people and people with many family members who also have diabetes, both being at higher risk. Deprivation is also a significant factor, with the prevalence of type 2 diabetes 60% more common among individuals in the most deprived quintile compared with those in the least deprived quintile in England. We also know that certain groups, particularly in a diverse community such as Birmingham, are at least 3 times more likely to develop type 2 diabetes than the white population. This is due to a mix of genes that make some groups more likely to develop diabetes, as well as non-genetic differences such as diet, lifestyle, access to healthcare, and deprivation. As you can see, a number of these are what we call modifiable risk factors, and the hope is that by targeting these through a number of interventions at the individual and community level, we might reduce the numbers of diabetes and build bolder, healthier Birmingham. A particularly useful tool, both to use for yourself or to recommend to other people, is Diabetes UK's Know Your Risk tool. This looks at individual risk of developing diabetes by combining some basic facts about an individual, including their weight, their waist circumference, and some of their family history, and will give you a much better idea about your ongoing risk of developing type 2 diabetes. It may even recommend that if you're at significantly higher risk, that you should get tested. Now that we know a little bit more about what causes diabetes, it might be worth us taking some time to have a look at what we can do to reduce the risks of both developing diabetes and the diabetes getting worse. In terms of preventing diabetes, the government have outlined 3 key goals, which are ones that you may have seen elsewhere across public health. Helping people to achieve a healthy weight, support healthy food choices, and achieving a good amount of physical activity all contribute towards reducing the number of people with poorly controlled diabetes. These can also be separated into things that would help for those patients that already have diabetes, but also community-wide interventions to help prevent people from getting diabetes in the first place. Achieving a healthy weight means having a BMI of less than 25, and a particular emphasis on waist circumference. Ideally, this should be less than 31.5 inches in women and 37 inches in men. We know that particularly individuals with a larger waist circumference are particularly at higher risk of developing diabetes. The other 2 goals that we just talked about will also help with this, especially aiming for healthy eating. A healthy diet is one that consists of balanced eating and may incorporate some of the advice on the screen. I appreciate it's quite a busy slide, so I'll give you a few moments just to have a look at some of the general advice that's been put there. In general, slower release carbohydrates and healthier fats are particularly good at protecting against diabetes, whilst foods with added sugars and high salt content are less good for you. Now, I know that we had a webinar a few months back on physical activity, so I won't go into too much detail on it again here, but just a reminder that current guidelines is for at least 150 minutes of moderate activity spaced out over a number of days across the week. In terms of public health interventions, some of the ideas of schemes that are already in place are shown on screen now, and it might be worth taking a few minutes to think about which of these you may have seen yourself, or which could be implemented into your area of working. Particularly, one thing that wasn't mentioned in the previous slides is working out who is at risk of developing diabetes or already has diabetes before they become more significantly unwell. By identifying these individuals and offering them support early on, we can potentially reverse their diabetes or prevent them from getting worse outcomes. This is where a really important concept known as pre-diabetes comes in. Pre-diabetes is where the blood sugars have started to become higher than normal, but not high enough to be classed as full diabetes. It won't cause patients any symptoms, and many people won't even be aware that they're at higher risk. But early identification and early intervention can potentially stop someone from developing full diabetes. This could be where a Know Your Risk calculator could really help either yourself or members of the community think about getting their blood sugars checked at their GP and then getting the support that they need. So we've covered a bit about what causes diabetes and what the symptoms might be, as well as looking at how we can make things better on an individual or a community-based level. Now I think it's time for us to have a look at exactly how you as community champions can help to make things better. In terms of ways in which you as bolder, healthier champions can work to help, awareness and information about diabetes is absolutely key. So passing on the information that you have to members of the community, including the Know Your Risk calculator that we mentioned, is absolutely vital. Using diabetes as yet another reason to promote healthy living in your respective spheres of influence is also crucial. Whether promoting community sports events or a push on healthy eating, even small changes can make a big difference in the long run. As mentioned earlier, people living with diabetes often have extra needs and may benefit from extra support. We especially know that the rates of poor mental health are higher in those living with diabetes than those without. Looking out for those most vulnerable and pointing them to some of the resources at the end of this webinar could be life-changing. If the webinar series that you've heard today has inspired you to do that bit extra for diabetes in your community, Diabetes UK have a Community Champions programme which empowers local champions to give targeted support in those communities that are at greater risk. Commitment involves a 2-day training course and at least 3 update events a year, and information can be seen on the link below. So to summarise, diabetes is a significant problem with many knock-on complications for the residents of Birmingham, and at current trends are only likely to continue and to increase over the next decade. By making every contact count, we can aim to turn the tide on new diabetes diagnoses and also to improve the lives of people currently living with diabetes in the community. There's a whole host of information out there on the internet about diabetes, but it's really important that we use sources that we can trust. Diabetes UK is a charity that has a fantastic wealth of information online, and the NHS Choices website also gives a broad information set about a number of different health problems. For those people who are currently suffering with diabetes, their consultants and diabetic specialist nurses can offer advice, and for people that are worried about their blood sugar levels, seeing a GP is always a good start. I'd like to finish by thanking you for listening to this webinar series.